process for prescription drugs, also for vaccines. It's called 21st Century Cures. Thanks for being with us, Congresswoman. We should note this is an election cycle, but this is a bipartisan effort all the way.
That's right. This is a bipartisan effort with me and Congressman Fred Upton from Michigan, who's the chair of the committee, the Energy and Commerce Committee, which I sit on. And what this is, it's a big picture look at how we do biomedical research in this country, and then how we get it from the research lab to the clinic. How can we do it more efficiently? How can we do it so it's targeted more at individuals? And then how can we get those drugs and devices approved and into the clinic?
You've been having roundtables. You want to hear from people. You had one in Denver yesterday. What are you hearing most? Do you sense a frustration that there might be something that can help, so why does it take so long to get it to the people who need it?
That's exactly right. Don't forget, the NIH and our research institution, those institutions were set up over 100 years ago. And so the way we do biomedical research now, it's very different. We can take somebody's genome and figure out exactly how we can get a cancer drug to them. And so if we restructure the way we do medical research in this country, we can be much more efficient, and we can get those cures tailored to people much more quickly. And that's what Fred and I are working on.
Yeah, update a system that desperately needs to be updated.
Yes.
Colorado is the first state in the nation to pass the Right to Try bill, allowing terminally ill patients to be part of medical studies. Would that work in conjunction with your effort?
Yes, we have some federal laws on the books right now that allow people to make a petition if they have a disease where there's no treatment to get an experimental drug. But we need to improve that even more. But the thing is, for some of these rare diseases, if we update our research system, we might actually be able to get cures to those patients faster.
Because we've heard. We covered the story of Ryan Dunn. I know you know that story. He had Duchenne muscular dystrophy, wanted so desperately to be part of a medical trial, and just a desperation from the families who just want their loved ones to get help.
Well, and you know, if we fix the way we do biomedical research, everybody could potentially have their data in a central database, and of course they would have their privacy protected, but everybody could be part of a trial in a way. And so there's just so many advances. And the thing that came out yesterday at this hearing that made me so excited, the researchers said we are just that close. If we make the systems work and we give the funding to do it, we are that close to being able to find revolutionary cures. And that was exciting to hear researchers say that.
And you mentioned funding, and that is the one hurdle that will be need to jump.
Well, I think that if we were able to tell people, if we do these things, if we restructure biomedical research, and we need this amount of money to do that, I can't think of an American who wouldn't say, let's find that money.
All right, Congresswoman DeGette, thank you so much.
Good to be with you.
I know you'll do more roundtables. We'll have information on how you can be a part of those if you're interested on 9news.com. Thanks.
All right, thank you both.